So the word anatomy comes from Anna and Tommy. What does it mean? To cut. So the whole anatomy is learned by cutting, and that is what is called as dissection. You will be dissecting. So even an organ, if you want to describe, that organ has to be described in normal anatomical position. If you have to describe a bone, you have to describe it in normal anatomical position. So कैसा है normal anatomical position? खड़े रहो सब लोग. Because our HOD sir has come. आप normal anatomical मैंने बोला है नहीं करने. Okay. So now everybody stands in normal. No. हाँ बट मैं उनको नॉर्मल एनाटॉमिकल पोजीशन में खड़े रहने को बोला. चलो सब लोग मेरी तरफ क्यों देख रहे? सामने देखने का. Everybody, so you should be looking in the front. एवढा इतना नहीं हाथ दूर. हाँ बाजू में. हाँ ऐसा नहीं. हाँ महालक्ष्मी दर्शन नवरात्रि चालू हो गया. So this is what? Normal anatomical position. बोलेंगे नहीं. तो clavicle will be described horizontally. Humerus will be described vertically. Pelvis will be described tilted. Liver will be described like this on this side. You know. So in this position, what is the position of the bone or the organ? Okay. Sit down. Then there are some planes, median plane. अभी सर इसके बारे में और ज़्यादा बताएंगे आपको. सर आप you want to start? बोलिए ना median. मैं I'll stand beside you and I'll. टर्न करें.
In anatomical position, there are three fundamental planes, PLA and ES. First plane that we describe is called as a median plane, MEDIAN, median plane. Median plane is a plane which divides the body into two identical halves. Which plane is median plane? Right, median. Is it two exactly identical or it looks identical? Looks identical. Because inside the body it's not identical. But externally, according to the word, median plane is the plane which divides the body into two apparently equal halves.
Apparently
Equal halves. But even is the external same? If you are right-handed, your right arm will be more powerful than the left. So the muscle will be bulkier on the right side. So the externally also is some difference, but say apparently equal. Internally is completely unequal. Apparently okay. Nearly equal. Any plane.
सर हेयर स्टाइल भी अनलेस अमिताभ बच्चन जैसा है तो दैट इज ग्रेट. बट हम लोग मोस्ट ऑफ अस बॉयज में
Any plane that is parallel to the median plane is called as sagittal plane. Sagittal, have you heard of the The word Sagittarius. Sagittarius is a star sign, which means bow and arrow. And the arrow goes straight front to back. So the flame which is parallel to the Sagitta is called a Sagittarius. How do you spell Sagittarius? S-A-double-G-I and single G-I, followed by double T or single T-A. Remember the word Sagitta from Sagittarius. Single G-I, double T-A-N. That's Sagittarius. Now, a median Indian plane is parallel to the median plane is Sagittarius. But that median plane is parallel to itself also. So the median plane can also be called as the mid-sagittal plane.
Mid-sagittal plane. Median plane also called as mid-sagittal plane.
And anything which is not mid-sagittal is called as para-sagittal plane. Okay, mid-sagittal, para-sagittal, median plane. Okay, right angles towards sagittal plane. It divides the body into front and back halves, not equal obviously. It's called as coronal plane. Crown, C-R-O-W-N, is called in Latin as corona, C-O-R-O-N. So how you wear the crown there? Coronal. And the third plane is in left out. This was two vertical planes, but was sagittal was coronal. The third plane is at right angles to both these planes. And what we do call that plane as? This already learnt in school called transverse plane. Now, transverse plane means right angles to the long axis. Right angles to long axis. So our long axis is from top to bottom. Right angles to that is transverse. If you consider foot, the part of the body beyond the ankle joint, it's called foot. If you look at the long axis of the foot, it's front to back. Long axis of the foot is front to back. So transverse plane for the foot will be coronal plane. Right angles to long axis. Is it good? So if you say transverse plane, then you need to specify transverse plane or which part of the body. Instead of that, the plane which you consider as transverse is better called as horizontal plane. Horizontal. Parallel to the horizons. Okay? So when we say horizontal plane, in most parts of the body, horizontal plane is transverse. But in some parts, it is not transverse. Okay? So horizontal plane is uniform, right angles to the other two planes, and divide the body into upper half and lower half. Is that? Three fundamental planes, and repeat again, sagittal, coronal, horizontal. Sagittal has two subdivisions, intermidline, mid-sagittal. Away from the midline, parallel. Wherever two planes meet, they will form a line. Two planes intersect with a line, and they are parallel to each other. So, the sagittal and coronal plane intersect at a line which is vertical, running from top to bottom. See, in coronal, we get a line which is running from top to bottom. That line is in simple words called a vertical line. You can also sound more learned there. We start using the word supero-inferior line. Supero-inferior. Superior is above, inferior is below. It runs from top to bottom, superior, inferior. The sagittal plane and the horizontal plane depicted by running from front to back. The line which is running from front to back is called an anterior-posterior line. So superior-inferior line also called vertical line, anterior-posterior line. And now the third one, the coronal and horizontal plane. Depicted line which runs from left to right, or right to left. Either indefinitely extending on both sides. So that's the name for the line which is running from left to right. We use the word transverse line. So vertical, anteroposterior, and transverse. Do you remember structures which are closer to the midline are called as VDL, VDIAL, not to be confused with VDIAN, which means in the midline. VDIAL is close to the midline. And away from midline is called lateral. If we use the word for the transverse line as mediolateral line, mediolateral, it becomes a ray, not a line. Because from the midline, if you go away, only one side you will go. So if you start from the exact median and proceed on one direction, it will be half a line. Another half a line will be on the other side of the midline. That's why you don't use the word mediolateral. And it's confusing if you call it as lateral, side to side. How much will they say? So we use the word transverse. All lines are indefinitely extended of the top.
The terms medial and lateral are again related. For example, my superior extremity is lateral to the trunk. But in this superior extremity, this surface is medial and this surface is lateral. Okay? Now, this is medial and I'm saying my trunk is medial to the superior extremity, but still this part of my trunk is the lateral. So this part is medial. Okay, so it's a very, very relative terminology. Okay, what structure, a structure may be medial to something, but same time it can be lateral to something also. Okay, like limbs are lateral to the trunk, but it itself has surface, one surface called as medial, one surface which is lateral. Trunk, again the part which is farthermost is the lateral surface. Okay?
So for example, usually, and all these terms are to use only in anatomical position. So in anatomical position, the middle finger is medial to the thumb. This is medial to the thumb, closer to the midline. The same middle finger is lateral to little finger. Are you getting the term? So superior, inferior, anteroposterior, medial, lateral are all relative terms. Which is closer to the midline is medial. So except for structures which are exactly in the midline, then there is no relative term with them. But other terms are either side of the midline. Two of them, one may be close, one may be away.
Same thing for the lateral most structures, like on the thumb, the lateral surface. When I talk, this is my thumb, this is the lateral, then there is nothing beyond that. But in the thumb also, there is a medial surface and a lateral surface. Okay? But beyond the lateral surface, there is no. That's the lateral most point. Like we talked about the median plane, which is exactly in between.
So the top of your hair, if you make it erect, and you are superiormost surface, sole of the foot is the most inferior. When it comes to the front surface, it's a little trickier. Some people have got a large belly. When standing, they can't see their foot. In that case, the belly is the most accurate surface. Some people have a long nose and a flat belly. So they try to go to the mirror. The first part of the body which touches the mirror is the nose. That is the most accurate surface. So anterior is not very extremely relative. This is the most anterior surface.
So this part in the normal anatomical position, what we see is the anterior surface. Also, in anatomical language, we also have terms called as ventral surfaces.
The word venter, V-E-N-T-E-R, means belly, B-E-L-L-Y, belly. Whatever on the belly surface is ventral. Whatever on the posterior surface is dorsal. T-O-R-S-A, dorsal, means back. Usually these terms are used more or less in embryology. Belly surface and back surface, ventral surface and all this. We use it in gross anatomy also, but more commonly in the zoological terms, ventral and dorsal. So for a dog, the inferior surface is ventral, for the belly of the individual, and the superior surface is the dorsal. Yes, a dog or a horse would probably, we see dogs more commonly. So, ventral and dorsal. It changes. The etymological term for superior and inferior. Superior means towards the head. So it's called as cranial, opposite of which is the tail, after lower leg, tail, collar. So cranial, cranial towards the head, collar towards the tail. Even though you don't have a tail, you see a small tail bone. The alternative term for cranial is cephalic. C-E-P-H-A-L-I-C, cephalic. The word cephal means head, H-E-A-D, head. Opposite of cephalic, there's no alternative term for caudal, so you call it caudal. Some people use the word cranial caudal, some say cephalic caudal. What about two structures which are in the head? But one is above, one is below. So the upper part of the two is a cranial, but you can't call the lower part of caudal because it's the head itself. So in the head, we don't use the word cephalic caudal. In the head, we use the term rostrum caudal. Rostrum, R-O-S-T-R-U-M, rostrum means beak, B-E-A-K, beak. So whatever is closer to the beak, now in our humans, there are no beaks, but there are lips. Whatever is closer to the lips is rostrum. Away from the lips is called. Okay? This is there. So cephalic caudal, cranial caudal are used for structures which are not inside the head, not component structures within the head. Within the head itself, we use the word rostral caudal. So we have used four alternative terms: ventral dorsal, cranial caudal. Luckily, the medial lateral has no alternative term, medial lateral. Of course, If you are comparing one structure from the left and then structure from the right, you don't use the word medial lateral. You don't say left kidney, say left kidney, right kidney. You don't use the word medial kidney and lateral kidney because there are other signs. So you use left, right. If you want to sound more learned, complicate the issue and use Latin language. Levo dextro. Or sinistro dextro. The word sinister in English means mean, angry, evil. Dextro, here there is nothing like that. Sinistro means left side. Dextero, from where the English word dexterity has come, dexterity. Is the right side because the skillful part, dexterity is skill. 90% of the people in the world are right-handed and they are skillful hand is the right. So, right is for dextro and even if you are left-handed, dextro always is right. Okay? So 90% of the population are right-handed, 10% are left-handed. And some people say, for example, Sachin Tendulkar, he bowls with his right arm, he signs with his left hand. Okay? So he's really called as left-handed or right-handed? Skill is writing. If you are writing with the left hand, he is left-handed. People say he is a right-handed batsman. Batsmen don't have right hand, left hand, they use both their hands. So, bowling and signing depend on which is skillful part. So, how many of you here are left, right with the left hand? Raise your arm. 1, 2, 3. 3. Okay, give your hand. 3 is not 1/10, right? So lesser than 1/10. So can you safely say that people of science are more right-handed than left-handed? Or people of arts, artistic drawings, sculpture, painter, they are more left-handed than right-handed. This is a very small sample size. Could take that as an assumption. But I have been checking this out for the last 30 years. That on an average you see 10% are left-handed. It is always less than 5% who are left-handed in MBBS. So the left-handed people have a disadvantage to form a majority, but they are always better drawers. And you will relatively drawing there is a lot of weightage. They are absolutely more skillful because drawing is a job which is constructed in the right hemisphere. And since the right hemisphere, the cerebral hemisphere directly controls the left hand, they can portray whatever they have in their mind directly onto a paper. Whereas for those who are right-handed, the information from right hemisphere needs to go to the left. From left it will come to the right hand, and then you will portray that on the paper. Anytime you are having a relay race, the baton can fall in between. So what you have in mind will not exactly come on the paper when you are right-handed. Anyway, with practice you will always come up.
There are two more terms. They are superficial and deep. Again, they are relative. Because my skin is superficial. My muscle is deep. Right?
And the muscle is superficial and the bone is deeper still. Everything over. Closer to the skin is superficial. Away from the skin is deep. So as you descend, you always descend from superficial to deep. We have to cut the skin first, then we can enter deep. That is only.
9:30 will give you a break for 5-10 minutes. Then we'll start the next session at 45.
Two other terms which are there is called as proximal and distant. Proximal. The word proximal from where the English word approximate has come. Close to. And distant from where the English word distance has come. Far off. Closer to and far off. These terms originally were used only for upper limb and lower limb. The part of the upper limb closer to the trunk is called proximal. The part of the upper limb away from the trunk is distant. Proximal, distant. Remember, we are using the word upper limb. Some people call it as superior extremity. Upper is superior, limb is called as extremity. Don't use the word loosely, arm, forearm and hand. The region of the superior extremity between shoulder and elbow is arm. Elbow and wrist is forearm. Beyond wrist is called hand.
For lay people, my hand is paining. मतलब
Anyway, the now is medical, hand is very restricted part of the upper limb. Part of the upper limb beyond the wrist. Shoulder to elbow, arm, wrist, shoulder to elbow is arm to wrist is forearm, beyond forearm is hand. Similarly, in lower limb, the hip to knee is thigh, knee to ankle is leg, beyond ankle is foot. Thigh, leg and foot. So you learn in school, I run on my hand, I run on my legs. You don't run on leg, you run on your foot. For them, leg means lower limb. For us, lower limb is lower limb, or inferior extremity is inferior extremity. Three parts of the inferior extremity is thigh, leg and foot.
लोग थाई में नॉर्मली गड़बड़ नहीं करते, पीपल ज़्यादा हुए, बट लेग इज द मोस्ट अब्यूज्ड वर्ड बाय ले पीपल. जैसे माई लेग इज पेनिंग, मतलब किधर भी हो सकते हो, यहाँ पे यहाँ पे यहाँ पे.
As you said, instead of for us to sound more learned, we translate all the same things in Latin, so others will understand your ignorance. So, arm, A-R-M, arm is called as brachium, B-R-A-C-H-I-U-M. Forearm is called as antebrachium, A-N-T-E, brachium, antebrachium, and hand is called as manus, M-A-N-U-S, manus. Okay? Brachium, antebrachium, ante means front of, brachium and manus, and lower limb. Thigh is called as femur.
आपको सब रेज योर हैंड ना, आपको कुछ समझ नहीं क्या चाहिए आपको. हाँ, क्या लिखा आपने. हाँ, उसको
M-A-N-U-S, manus, hand.
मानुस.
Say use the word manual laborer, because those who use their hand for labor. Thigh is called as femur. Leg is called as crus, C-R-U-S, crus. The plural of which is crura, C-R-U-R-A. And the foot is called as PES. PES, PES is also called PED, PED, PED. So where the word pedal, pedestrian is come, PES or PED is the foot. Remember,
आपने थाई के लिए क्या लिखा? नहीं लिखा ना?
thigh is called as femur. FEMUR, femur. Remember, the bone of the thigh is also femur. The bone of the arm is not brachial, it is humerus. So you have separate terms for arm bone and arm region. Arm bone is humerus, arm region is called brachial. But unfortunately there is only one word for thigh and thigh bone. So if you want to differentiate the two, thigh bone should be called as os femoris. Os, os, os femoris. F-E-M-O-R-I-S. Os femoris. So that specifically thigh bone. Usually when we say femur, they are referring to os femoris. When you want to use the word thigh, you say thigh. But there is a common word for the two is thigh region or thigh bone. So you heard now one word extra, which is purely medical, is os. What does os mean? What is os? Bone. Os is bone. The plural is ossa. O-S-S-A. This is a Latin word. There is an exact Greek word for bone, and that is oste, O-S-T-E, oste. There is a word for bone in Greek. Most of the anatomical terms are in Latin, and most of the clinical terms are in Greek. So if there is infection of the bone, it is osteitis. I-T-I-S. Osteitis. Itis is a Greek suffix for infection. Usually, when bone is infected, the inside bone marrow is also infected. The word for bone marrow is M-Y-E-L. M-Y-E-L. I. This is the bone marrow. So bone and bone marrow is infected, osteitis. But whenever you are combining two nouns, there is a combining letter which is called, which is in this case is O. Combining letter oste and mine cannot be directly joined. You add an O between it. So it is osteomyelitis. Osteomyelitis, infection of bone and bone marrow. Whenever you are combining a noun with a suffix itis, if the suffix starts with a vowel like I-T-I-S, there is no need for combining anything with it. So you can directly say myelitis. But if the suffix starts with consonant, L-O-G-Y, say for example, then you have to add the combining letter O. Study of bones is called as osteology. Osteology, because logy starts with L. L means L is starting with a consonant. So osteology. Bio, B-I-O, bio is the Greek word for life. I want to add study of life, logy to GY. You don't have to add another O because the O is already there. So you say biology. Remember, bi is not life. It's a die plus O plus logic. 7. Bio is one word. Bio. Bio is one word. Bio. Study of muscles is called biology. Infection of muscle, bioitis. Yeah. Twist of terms, bioitis. You require a connected letter because the vowels are differently sound. So you add, here you can't add an O. Alternative term for O is S. So use the word myositis. These are all, like if you learnt Marathi, if you learnt Sanskrit, you know there are some sandhis, some rules of sandhis. Here, corrected letter usually no, rarely it is. When it comes to pain, P-A-I-N, pain, the word for pain is angia, A-N-G-I-A, angia is pain. And pain of the muscle, bio plus angia, IO and will sound proper, O is dropped, you say myalgia. Okay? So there are some such quirks which are there. But you now write three words, as, husky, while, arrow, and muscle bio. Okay?
So we are just stopping this.